Good evening and welcome. In today's video, we're talking about something remarkably simple, but potentially powerful. For anyone dealing with stiff, aching joints or cartilage-related issues, especially seniors, there's a natural approach that has been quietly used in traditional wellness systems for generations, and it involves something as humble as a leaf. Yes, a leaf that you may already have in your kitchen or can find easily in a nearby herbal shop. When applied the right way before bed, it may help support your body's natural ability to soothe inflammation, reduce discomfort, and possibly even assist in regenerating cartilage over time. Let's begin by understanding a basic fact. Cartilage degeneration is a common issue as we age. It's what we see in conditions like osteoarthritis, where the smooth, cushioning tissue in our joints begins to wear down, leading to pain, stiffness, and limited mobility. While medical interventions and physical therapy remain important components of treatment, many people are also exploring how natural methods can complement their current routines and help promote joint health from the outside in. Now, this is where nature gives us a fascinating tool. One of the most respected leaves in traditional herbal medicine is the bay leaf. Yes, the same aromatic leaf used in cooking. In some regions, people also use castor leaf, guava leaf, or even betel leaf, depending on the traditional practices of that area. These leaves have long been used topically in ancient systems of medicine like Ayurveda and folk remedies because of their strong anti-inflammatory and analgesic properties. Bay leaf in particular contains active compounds like eugenol, tannins, flavonoids, and antioxidants. These help reduce oxidative stress in tissues, calm down inflammation in the joints, and provide a soothing effect on muscles and ligaments. The idea is not that this leaf will magically rebuild your cartilage overnight, but rather that it helps create a local environment on the skin and underlying tissues that support circulation, eases stiffness, and may promote tissue recovery over time, especially when paired with good nutrition, mobility, and restful sleep. So how do you actually use this remedy? It's quite simple and calming, almost like a bedtime ritual. First, take 2 or 3 fresh bay leaves. If you only have dried ones, that's okay too. Just soak them in warm water to soften them. Lightly crush the leaves to release their natural oils. Some prefer to warm them gently over a pan for a few seconds. You then take the crushed or warmed leaf and apply it directly to the joint area, most commonly the knees, shoulders, elbows, or fingers. You can even use it on the lower back if needed. Gently massage the area using circular movements. The goal is to allow the natural oils and bioactive compounds from the leaf to absorb through the skin. If you want to enhance the effect, wrap the area in a soft, clean cotton cloth or bandage to keep the warmth sealed in. This helps activate deeper tissue response during sleep when your body's repair systems are most active. Leave it on overnight or for at least 1 to 2 hours before bed. As you sleep, the mild warmth and natural properties of the leaf work subtly to ease inflammation and discomfort, giving you a more restful night and hopefully a fresher, more mobile start the next morning. It's important to note that while many seniors and joint pain sufferers have reported feeling more flexible and less stiff after consistent use, this isn't meant to be a stand-alone cure or replacement for medical treatment. It is a supportive measure. Think of it like brushing your teeth. It's gentle, regular care that contributes to long-term health. And yes, consistency is key. Doing this once won't be enough. Try using this remedy 3 to 5 nights a week for at least a month and monitor how your joints feel in the morning. Now, before you try this at home, here are a few precautions. Always do a patch test on a small area of skin to make sure you don't have an allergic reaction or irritation. If you have highly sensitive skin, open wounds, or are taking certain medications, it's a good idea to consult your healthcare provider first. And if you notice redness, burning, or increased pain, discontinue use immediately. The idea here is to work with your body, not against it. The best part about this remedy is how it fits into a broader philosophy of senior health. Gentle, sustainable, and natural care. When combined with good hydration, nutrient-rich foods that support cartilage, like those rich in collagen, vitamin C, and magnesium, and light physical activity such as stretching or walking, the body often responds in positive ways. Healing isn't always dramatic. Sometimes it's the small daily habits that allow for deep internal changes. As we age, our bodies still retain the remarkable ability to repair and adapt, just at a slower pace. And when we give it the right support, from within and from the outside, we can continue to feel better, move easier, and enjoy more freedom in our daily lives. So if you've been waking up with joint pain, if your knees crack more than usual, or if stiffness is holding you back from your favorite activities, try adding this natural leaf remedy to your bedtime routine. It's simple, it's affordable, and it just might be the missing piece in your joint care regimen. As we age, our bodies naturally begin to show signs of wear and tear, especially in our joints. This can lead to stiffness, discomfort, and reduced mobility, challenges that many seniors experience daily. While modern medicine offers a variety of treatments for joint pain and cartilage degeneration, there has been a growing interest in exploring safe, natural alternatives that support long-term joint health. These remedies aren't meant to replace medical treatment, but to complement it in a gentle and holistic way, offering additional relief and nourishment to the body without harsh side effects. Natural remedies for joint health have been used for centuries across different cultures. From herbal compresses to plant-based oils and topical treatments, many of these age-old practices are gaining renewed attention due to their simplicity and safety profile. What makes them so appealing is their ability to work in harmony with the body's own healing mechanisms. Instead of forcing quick changes, these natural approaches aim to support circulation, reduce inflammation, and improve flexibility gradually over time. One of the biggest advantages of natural joint care is that it often involves substances that are easily available, non-toxic, and well tolerated by most people. Leaves, herbs, and oils derived from plants like turmeric, castor, eucalyptus, bay, and guava have shown promising properties such as anti-inflammation, analgesia, and antioxidant activity. These properties help manage joint stress and may promote recovery in tissues affected by daily strain, aging, or mild injury. More importantly, they can be used regularly, even daily, with minimal risk when used correctly. The key to success with natural remedies is consistency. Many seniors find that incorporating these gentle methods into their nightly routines helps them wake up with improved joint flexibility and less discomfort. Whether it's through warm herbal compresses, leaf-based massages, or essential oils, the ritual itself promotes relaxation, which further supports the body's natural repair processes, especially during sleep. Sleep, after all, is the time when our bodies restore and regenerate most efficiently. Choosing natural remedies doesn't mean rejecting science. In fact, many plant-based compounds are currently being studied and even used in pharmaceutical formulations. But using them in their whole, unprocessed form, through gentle topical applications or therapeutic rituals, offers a safe and accessible entry point into self-care for joint health. When paired with a healthy lifestyle that includes movement, good nutrition, and hydration, natural remedies can become a powerful part of an overall joint wellness plan. It's important, however, to approach natural joint remedies with realistic expectations. These are not quick fixes or miracle cures. Instead, they are tools for long-term maintenance and support. Used wisely and consistently, they can reduce dependence on medications, improve comfort levels, and help maintain independence in later years. As more people seek ways to age well without relying solely on medications, natural joint care offers a hopeful, empowering path rooted in tradition, supported by emerging science, and grounded in the daily act of caring for one's body. Among the many natural remedies available for joint care, one ingredient stands out for both its rich history and its practical benefits: an ordinary kitchen staple that holds extraordinary healing potential. The bay leaf, known for its distinct aroma and flavor in cooking, is much more than just a spice. It has been used for centuries in traditional wellness systems, such as Ayurveda and folk medicine, for its natural anti-inflammatory, pain-relieving, and antioxidant properties. While it may seem surprising that something so common can offer health benefits beyond the kitchen, the bioactive compounds found in bay leaves speak for themselves. Bay leaves are packed with powerful plant chemicals like eugenol, cineol tannins, and flavonoids. These compounds have been shown in various studies to exhibit anti-inflammatory effects, which is crucial for anyone dealing with joint discomfort, swelling, or stiffness. Eugenol, for instance, is a natural pain reliever and anti-inflammatory agent that can soothe the irritated tissues when applied topically. Flavonoids help protect cells from oxidative damage, supporting overall tissue health, including that of cartilage, tendons, and ligaments. The presence of these compounds in a single leaf makes bay leaf a valuable natural aid for individuals seeking gentle yet effective ways to manage joint health. What makes bay leaf especially attractive as a home remedy is its accessibility and ease of use. Unlike synthetic creams or over-the-counter medications that may contain harsh chemicals, bay leaf is natural, affordable, and generally well tolerated when used appropriately. It can be used in multiple ways: crushed into a paste, warmed and applied directly to the joints, or even infused into natural oils for massage. When used before bed, bay leaf applications can support relaxation while its beneficial compounds slowly penetrate the skin and underlying tissues, working overnight in alignment with the body's natural repair rhythms. In many cultures, elders have long believed that wrapping aching knees or stiff fingers with warmed bay leaves offers a soothing effect and promotes better joint flexibility by morning. Though these remedies were once dismissed as folklore, modern interest in plant-based healing is beginning to validate what traditional healers always knew: that nature often holds effective solutions that are both safe and sustainable. Importantly, while bay leaf can provide significant support, it should not be viewed as a cure-all. Its true power lies in its ability to contribute to a broader wellness routine. When combined with light movement, a balanced diet rich in joint-supportive nutrients like collagen and omega-3 fatty acids, and proper hydration, bay leaf becomes a part of a holistic system that encourages long-term joint maintenance. And because it is applied externally, it avoids the gastrointestinal side effects that some people experience with oral medications. As always, a few precautions are necessary. People with sensitive skin should perform a patch test before full application, and if irritation occurs, the remedy should be discontinued. It is also wise to consult a healthcare provider if you have underlying health conditions or are taking medications, to ensure that no unexpected interactions occur. The simplicity of bay leaf is what makes it so appealing. It doesn't rely on complicated processes or expensive ingredients. It invites people to engage in a daily act of self-care that is both nurturing and therapeutic. In a world full of quick fixes and overcomplicated health routines, this modest leaf reminds us that sometimes gentle, natural methods can offer lasting comfort and support for the aging body. Cartilage is the smooth, flexible tissue that cushions our joints and allows for pain-free movement. As we age, cartilage naturally begins to break down, leading to stiffness, reduced mobility, and chronic joint pain. Supporting the health and longevity of cartilage becomes essential, especially for seniors who wish to stay active and independent. This is where certain medicinal leaves, such as the bay leaf or castor leaf, offer valuable support through their natural healing compounds. These leaves don't regrow cartilage overnight, but they do create conditions that support the body's natural repair processes, while helping to ease the symptoms associated with joint degeneration. Medicinal leaves like bay leaf are rich in bioactive compounds including eugenol, linalool, and various polyphenols that contribute to their anti-inflammatory, antioxidant, and mild analgesic effects. When applied topically to aching joints, these compounds can penetrate the skin and interact with the underlying tissues. They help to reduce inflammation in the synovial fluid and surrounding tissues, which is a key contributor to cartilage wear and pain. Inflammation not only damages cartilage, but also accelerates its breakdown. By calming this inflammatory response, the leaf may help slow this degeneration process and offer relief from the discomfort that often comes with aging joints. Another important aspect is the improvement of local blood circulation. When the leaf is slightly warmed and applied with gentle massage, it can help stimulate blood flow to the joint area. Better circulation brings more oxygen and nutrients to the cartilage and surrounding tissues, which supports tissue repair and cellular regeneration. Cartilage is a vascular, meaning it does not have its own blood supply, so improving the circulation around it is one of the few ways to indirectly nourish and protect it. This is one reason why consistent external application of medicinal leaves may provide long-term joint benefits. In addition to reducing inflammation and improving circulation, these leaves contain antioxidants that combat oxidative stress. Over time, oxidative stress from free radicals can damage joint tissues and worsen arthritis symptoms. The antioxidants present in bay leaf and similar leaves help neutralize these harmful free radicals, potentially slowing down the degeneration of cartilage and supporting overall joint integrity. Moreover, the soothing effect of the leaf application, especially when part of a nightly self-care ritual, can also help relieve muscular tension around the joints. When the surrounding muscles are relaxed, there is less strain on the joint, which can indirectly reduce the pressure on cartilage. This, combined with better sleep quality from reduced nighttime pain, gives the body a greater chance to engage in natural healing and regeneration during rest. While it's important to remember that no single leaf or natural remedy can reverse years of cartilage damage, these supportive effects make a meaningful difference over time. When used consistently in combination with a nutritious diet rich in vitamins like C and D, collagen-boosting foods, gentle exercise, and proper hydration, the use of medicinal leaves can form an effective part of a well-rounded joint care strategy. Using a medicinal leaf like bay leaf or castor leaf as a part of your bedtime routine is not only simple, but also a calming and therapeutic way to care for your joints. The goal is to deliver the natural healing compounds in the leaf directly to the affected area, while your body rests and recovers during sleep. This application method doesn't require expensive tools or complicated techniques, making it accessible for most seniors and individuals seeking natural support for joint discomfort or cartilage issues. The key lies in consistency, gentle handling, and allowing the natural elements to work in harmony with your body's nightly healing process. To begin, select fresh, clean leaves, either bay leaf, castor leaf, or guava leaf, depending on availability and traditional preference. If you're using dried leaves, they should be softened by soaking in warm water for a few minutes. Once ready, gently crush the leaves with your fingers or lightly bruise them with the back of a spoon to release their essential oils. This step activates the natural compounds such as eugenol, flavonoids, and tannins that support anti-inflammatory and pain-relieving effects. Next, slightly warm the crushed leaves by placing them in a clean pan for a few seconds. Be careful not to overheat them, as excessive heat can damage their active ingredients. The warmth helps open up the skin's pores and allows for better absorption into the tissue below. Test the temperature on your wrist before applying to ensure it is soothing and not too hot. Once the leaves are warm and ready, place them directly on the joint you wish to treat, commonly the knees, elbows, shoulders, or fingers. Gently massage the area in circular motions for a few minutes. You can also use a carrier oil like coconut oil, castor oil, or olive oil to enhance the massage and help the compounds penetrate more deeply. These oils themselves have mild anti-inflammatory benefits and improve the skin's ability to absorb the healing agents from the leaf. After the massage, you can choose to leave the leaf on the joint, especially if it is still slightly moist and warm. Wrap the joint loosely with a soft cotton cloth or gauze to hold the leaf in place and retain the warmth. This covering also prevents the leaf from moving during the night and avoids contact with bedding. It's important to keep the wrap loose to allow for comfort and circulation. Leave the application on for at least 1 to 2 hours before bed, or if comfortable and safe, allow it to stay on overnight. During this time, as your body shifts into rest and repair mode, the natural compounds in the leaf continue to interact with your skin and underlying tissues. This nighttime setting is ideal because your muscles are relaxed, you're not putting weight on the joint, and your body is more receptive to subtle healing influences. Performing this remedy 3 to 5 times per week can gradually bring noticeable improvements. Many individuals report reduced stiffness upon waking, easier joint movement, and a greater sense of relief after consistent use. Like any natural remedy, the results aren't instant, but the effects can build steadily over time. Before starting this or any topical remedy, it's wise to do a small patch test on your forearm or leg to ensure your skin doesn't react negatively. If any itching, burning, or rash occurs, discontinue use and consult a healthcare provider. This method is generally safe for most people, especially when used with care, patience, and attentiveness. Incorporating this simple bedtime application into your nightly routine can become a soothing act of self-care. It not only supports your joints physically, but also adds a relaxing, mindful moment at the end of your day. A natural way to prepare your body for restful sleep while giving your joints the attention they need. While natural remedies like bay leaf or castor leaf are often rooted in traditional practices, there is increasing scientific interest in the compounds these plants contain and how they may support joint health. Although more large-scale clinical trials are needed to make definitive claims, many of the active ingredients in these medicinal leaves have been studied individually for their health-promoting properties. For example, bay leaf contains a compound called eugenol, which has been shown in research to possess anti-inflammatory and analgesic effects. Inflammation is a major contributor to cartilage breakdown and joint pain, and substances that reduce inflammation may help protect the joints and reduce discomfort over time. In addition to eugenol, bay leaves also contain linalool flavonoids and tannins, natural antioxidants that help neutralize harmful free radicals in the body. Oxidative stress caused by these free radicals is another factor that accelerates joint degeneration and aging. By reducing oxidative stress, these plant-based antioxidants may indirectly support the preservation of cartilage and overall joint function. Castor leaves, similarly, are known for their ricinoleic acid content, a powerful anti-inflammatory agent found in castor oil. Topical applications using castor leaves have been used for years in traditional medicine to relieve muscle stiffness and joint swelling, and now modern science is beginning to explore these effects more formally. Although the research is still developing, these findings offer promising evidence that supports the traditional use of medicinal leaves in joint care. However, as with any health practice, especially natural or alternative approaches, it's essential to prioritize safety. Just because something is natural does not mean it is suitable for everyone. Before applying any leaf or natural extract to your skin, it's important to perform a patch test. This means applying a small amount to a clean area of skin, such as the inner arm, and waiting 24 hours to see if any redness, itching, or irritation occurs. If the skin remains clear, it's generally safe to proceed with a larger application. For individuals with very sensitive skin, allergies to plants, or chronic skin conditions like eczema or psoriasis, it's best to consult with a healthcare provider before trying any new topical treatment. Additionally, those who are taking medications that thin the blood or affect skin sensitivity should use caution, as even natural products may interact in unexpected ways. Pregnant or breastfeeding individuals should also check with their doctor before using herbal remedies, even topically. It is also important to ensure that the leaves being used are clean and free from pesticides or chemical contaminants. Always wash the leaves thoroughly and source them from reliable, preferably organic sources. If using dried leaves, make sure they have been stored properly in a cool, dry place to prevent mold or bacterial growth. When preparing the leaf for use, avoid overheating it, as excessive heat can break down the beneficial compounds. Using medicinal leaves as part of your nightly joint care routine can be a gentle, low-risk practice when done correctly. The scientific evidence behind the active compounds offers encouraging support for their use, while traditional knowledge provides time-tested methods of application. By combining modern caution with ancient wisdom, this approach allows individuals, especially seniors, to explore a natural path to comfort and mobility. Always stay informed, listen to your body, and use these remedies as part of a balanced, health-conscious lifestyle. Caring for joint health and encouraging cartilage regeneration requires more than just one remedy or quick solution. It involves a holistic approach, a combination of natural practices, lifestyle choices, and consistent self-care that work together to support the body's healing processes. While applying medicinal leaves like bay leaf or castor leaf topically may offer relief and contribute to comfort. Their effectiveness greatly increases when they are part of a broader, more comprehensive wellness strategy. The body thrives when all aspects of health, nutrition, movement, rest, and mental well-being are addressed together with care and intention. Cartilage, unlike many other tissues in the body, has a limited blood supply. This makes healing slower and more difficult once damage has occurred. However, the body does have mechanisms in place to maintain and protect cartilage if given the right conditions. One of the most important aspects of this is nutrition. A diet rich in vitamins and minerals that promote cartilage integrity, such as vitamin C, vitamin D, magnesium, and zinc, is essential. These nutrients assist in collagen formation, bone density, and immune function, all of which support joint structure and regeneration. Including foods like leafy greens, berries, seeds, nuts, fatty fish, and bone broth can be especially beneficial. Regular, low-impact physical activity is equally important. Movement helps stimulate the production of synovial fluid, which nourishes the joints and keeps them lubricated. Exercises like walking, swimming, yoga, or gentle stretching not only keep the joints mobile, but also reduce stiffness and improve circulation. Better circulation means more oxygen and nutrients are delivered to the tissues surrounding the joints, indirectly benefiting cartilage. Physical activity also helps maintain a healthy weight, which reduces excess pressure on joints and slows the rate of cartilage wear. Another often overlooked yet vital part of joint regeneration is sleep. The body does most of its repair work during deep rest, particularly at night. By using topical applications like bay leaf massage before bed, you can create a soothing nighttime ritual that not only helps relieve joint tension, but also signals the body to enter a deeper, more restorative sleep. Quality sleep promotes the release of growth hormone and reduces stress hormones like cortisol, both of which can influence inflammation and tissue healing. Mental and emotional health also play a role in physical well-being, including joint health. Chronic stress can lead to increased inflammation throughout the body, making joint pain and stiffness worse. Incorporating stress, reducing activities such as deep breathing, meditation, or spending time in nature can help calm the nervous system and support overall healing. Taking time to engage in calming routines like a warm herbal compress, gentle stretching before bed, or even journaling can make a noticeable difference over time. Finally, consistency is key in a holistic approach. Natural remedies and lifestyle changes take time to show results, but they are often more sustainable and beneficial in the long run. When you approach joint health from multiple angles, combining nutritious food, physical activity, proper hydration, restful sleep, and natural topical treatments, you create an environment in which your body is more capable of maintaining and possibly regenerating cartilage. This gentle, whole-body strategy not only reduces symptoms but also empowers you to take charge of your health in a natural and balanced way. By treating the body with care and patience, and by integrating small daily habits that support joint function, individuals, especially seniors, can enjoy improved mobility, reduce pain, and a greater quality of life. This is the power of a holistic approach, not just treating symptoms but nurturing the body as a whole, allowing it to function at its best for years to come. In conclusion, taking care of your joints, especially as you age, doesn't always require complex treatments or expensive therapies. Sometimes, the most effective solutions are the ones rooted in nature, passed down through generations, and supported by growing scientific curiosity. The use of medicinal leaves like bay leaf or castor leaf as part of a consistent bedtime routine can be a gentle and supportive way to ease joint discomfort, reduce inflammation, and possibly assist in protecting the cartilage that keeps our joints strong and flexible. While these natural remedies are not miracle cures, they can play a meaningful role when combined with a well-rounded approach to health. Balanced nutrition, regular movement, stress management, and restful sleep all contribute to how our bodies repair, recover, and thrive. The application of healing leaves is just one piece of the larger puzzle, and when used safely and consistently, it can become a valuable part of your daily wellness routine. Remember, always approach natural remedies with mindfulness and care. Listen to your body, be patient with the process, and consult with a healthcare professional if you have any underlying conditions or concerns. By making informed and consistent choices, you can support your joints naturally and move toward a more comfortable, active, and independent life. One day and one night at a time. Thank you for watching, and if this video helped you, please consider liking, sharing, and subscribing for more thoughtful health guidance designed to support your journey toward better living. Stay well and take care.